is Schleif, and I am a cell and molecular biology major at Mansfield University. Today I will be touching on the global epidemic tuberculosis. Tuberculosis. What is it? First and foremost, tuberculosis is an infectious disease that is caused by Mycobacterium tuberculosis. This infection is spread through spit, sneezing, or coughing, producing airborne pathogens to be put out into the air to circulate for several hours. Anyone that inhales these pathogens can be infected. Tuberculosis can infect the kidney, which may cause blood in the urine, the brain, which can cause meningitis. This can cause headaches and confusion, the spine, which can cause back pain, and the lungs, which can damage the lung tissue and cause difficulty when breathing. Some symptoms can last for months. A cough can last to 3 weeks or more. You can develop chest pain, weakness or fatigue, or both. Weight loss can occur, or you can have a fever and night sweats. If not treated correctly, there is a chance of death. There are different kinds of tuberculosis: latent tuberculosis and drug-resistant tuberculosis. Latent tuberculosis is when one person is infected with TB, but they are not sick because the pathogen is inactive at the moment. This means they cannot spread tuberculosis to others, but can develop tuberculosis in the future. Compared to active tuberculosis, once one is infected, they can infect others, and the pathogen multiplies and destroys tissue within the body. Drug-resistant tuberculosis is when the bacteria is able to transform and adapt to defeat the antibiotic that was designed to kill them. This can in return be incredibly more difficult or impossible to treat. There are many ways to try to detect and treat tuberculosis. One way to detect is a skin test, which is called Montaux's tuberculin test. This is when tuberculin fluid is injected under the skin on the lower arm or hand. Within 48 hours, the person should come back and get their injection site looked at. What would be seen, if positive, is a raised bump at the site. Another way could be a blood test. This measures if the immune system reacts to the tuberculin pathogen. How to treat or prevent tuberculosis is with the basal Comet-Guerin vaccine, BCG. This is the only currently available vaccine to help provide protection against tuberculosis. This vaccine is live attenuated, meaning that the vaccine carries a weakened form of the pathogen so that the pathogen can trigger an immune response to develop memory within the body. This vaccine was first used in 1921 and since then has been administered to more than 4 billion people worldwide. This vaccine is given more in low to middle income countries in Europe that have high risk populations. Those administering the vaccine should be careful giving it to those who are immunocompromised, such as people with HIV, because they can have a terrible effect to the live attenuated vaccine and could possibly increase infection rather than prevention. Prescription drugs can also be used for tuberculosis, but those who are on them have to be on them for anywhere between 6 to 12 months. If prescription is stopped at any time, then that individual could be at risk of being sick again and developing drug-resistant tuberculosis, which will be harder to treat. The World Health Organization has summarized the recommendations on basal Comet-Guerin vaccination. A single dose of BCG vaccine should be given to all infants as soon as possible after birth in countries with a high burden of tuberculosis. Also, they say that contraindications are infants or persons known to have HIV or other immunosuppressive conditions in settings with adequate HIV services. BCG vaccination should be delayed for infants born to mothers known to be infected with HIV until these infants are confirmed to be HIV negative. Also, they say that BCG revaccination is not recommended as there is little or conflicting evidence of whether this confers additional protection, and revaccination may increase the risk for adverse effects. Tuberculosis is spreading throughout multiple regions of the world, making it a global epidemic. Tuberculosis is one of the world's top killers. About 10 million people are infected with tuberculosis each year, and from that 10 million, about 1.5 million die each year. Those that are immunocompromised with HIV contribute highly to the death rate because they are more likely to fall ill. The people more susceptible to getting sick are those who are malnourished, immunocompromised, those who use tobacco, or have diabetes. Low to middle income countries are the most affected due to poverty, limited access to healthcare, overcrowding, and malnutrition. Almost half of people that are infected are countries such as China, India, Bangladesh, Indonesia, Nigeria, Pakistan, the Philippines, and South Africa. Due to having to stay home because of the global pandemic, COVID-19, this made the crowded areas not so crowded, which brought down the diagnosis and infection of tuberculosis in populations. You can see in the graph that there was about an 18% fall after there was a large number of increased diagnoses from 2017 to 2019. COVID disrupted the amount of people being diagnosed with tuberculosis on a global level. This impacted individuals getting treatment. But at this time, there was stigma about having COVID and the worry of being quarantined. So those that had any symptoms of tuberculosis could have thought they were dealing with COVID instead and not getting treatment. Tuberculosis costs the world billions of dollars to try to treat and prevent, especially drug-resistant tuberculosis. This alone costs $20,000 to $586,000 to treat per year. The U.S. alone is required to contribute $9.2 billion annually to help fight the fight against tuberculosis. Low to middle income countries have an international donor funding program in place for tuberculosis, and the U.S. is the highest donor. The U.S. contributes so much to help the United Nations achieve the goal of getting lower diagnoses of tuberculosis by 2030. They alone in the past 2 years have gave $15.6 billion in 2021 and $16.1 billion in 2022. The U.S. says they want to contribute at least $13 billion every year. About 76% of the global fund is directed towards tuberculosis care, and the World Health Organization has an end tuberculosis strategy in place to drop new cases down 80% by 2030. To do this, we need all the high finances and commitment as a whole to combat against this deadly but preventable disease. Thank you guys for listening to me talk about the global epidemic tuberculosis, and here are my references.